Welcome. This video is intended to walk you through the low back pain EMR TELUS integration. It is based on the paper tool. We recommend that you familiarize yourself with the paper tool before using the low back pain EMR integrated tool. The algorithm is still the same, but we find it's useful to see from kind of a high level the different iterations depending on the patient's history to see what kind of information you will be presented with. Highly recommend that you look at this tool before starting your use of the EMR integrated. But let's go over to the EMR integrated tool. So first you're going to want to find the tool in your forms library. It's under CEP Providers, Clinically Organized Relevant Exam, Core Back Tool. Throughout the tool, you'll see patient-facing messages that are indicated with the key message, and any information or instruction to help guide you through the tool and provide you with more context. It will be found in a gray and yellow box. So the first thing that you do when using the tool is go through the history with the patient. Each question after answered will prompt the next question. So I'm going to not go through all of the different iterations, but more go through the iterations where information is going to change and some kind of key features of the tool itself. So let's say first the patient's pain is worse at the back buttock dominant and that it is constant. If it is constant, you're asked then to rule out any of the red flags. If any of the red flags are present, you'll be shown the recommended investigation as well as the message to consider other etiologies and investigations indicated. If they are not present, you'll then be served with a key message for the patient, and then you're prompted to answer the next question. Then in the fourth question, this is really checking the psychosocial yellow flags. So let's say that there is something that the patient can't do. You're then asked to review the yellow flags. Unlike the red flag section, this is recommended. It is not required for you to proceed. We do encourage you to go through the different yellow flags with the patient, especially if you will be returning to this tool at the patient's next visit. So we want to just kind of track if there has been any changes in the patient's history and presentation. If they are present, you're then provided with a recommended investigation and things to keep in mind, as well as resources that you can click through to use. If they are not present, you simply mark no. Then after running through the patient's history, we then want to move on to the physical examination to review or to refute or support the back pain pattern that's been identified based off of the patient's presentation. So under the physical examination, you're asked to take about 5 minutes to complete the 5 steps of the exam to avoid any important diagnostic information. We recommend the bolded tests as the minimum required for the exam, and you can select depending on the test that's being requested, whether it is normal, pain, limited range, or pain and limited range. And then for the other exams, we have the choice between normal and abnormal. If abnormal, you then indicate whether it is left, right, or bilateral. Let's though say our patient all was normal in the suggested recommended. We're then instructed to proceed on to Section C, the initial management, to review the patient's pain pattern and related initial management recommendations. So click on the plus sign to expand the section. And you'll see here pain pattern 2 was identified based off the patient's history and the confirmed with the physical examination. Within the pain pattern 2, there's recommended functional activities you can provide to the patient, medications, and then a section for you to include any additional notes that you have related to the patient. This section is also really helpful if there are any of, you see on the side here, the patient resources that you want to recommend for them. So in this section on the patient resources, we've included the destination that clicking through will take you. So, for example, the patient education inventory will open up a custom form that you can add to the patient's note and print. So let's say we want the patient to read through the Choosing Wisely guidelines on imaging tests for low back pain. We would just add the URL that we recommend the patient return to. And then you can also include any other recommendations that you have for the patient in this additional notes section. Then you can click and print the takeaway for the patient. If you want to include any of the key messages in that printout, you would just select on the key messages, and then that gets printed out for the patient to take away with them. Another feature of the pain pattern initial management section is under the follow-up. If the follow-up is PRN, you would simply select PRN. However, if you do recommend that the patient return in 2 to 4 weeks, you can select there, and then wherever you see send a reminder message, if you click on it, it will automatically send yourself, so essentially the initiator, a reminder message that, depending on your clinic's workflow, you could forward on to whomever is responsible for scheduling those follow-ups. You can also append and change the due date as well. Then we have the next steps section. This section is really, we're trying to kind of track if it's determined necessary and there are other referrals that you intend to initiate. So let's say you intend to initiate a rehabilitation referral. It shows you the different criteria as well as the option to send yourself a reminder message, to review the patient's core back tool and refer. Same applies for surgical consults, where delivered the different criteria for surgical consult and the option to send a reminder message to self. Same applies for the other subspecialists. If clicked through, you can send yourself a reminder message. And then lastly, for diagnostic imaging, if you intend to send or to refer the patient for diagnostic imaging, you can select here, send yourself a reminder message, and then also at the same time there is that kind of reinforcement around the appropriateness of imaging related to low back pain for the patient. And then finally we have the notes section. If there is anything that you were unable to collect during the rest of the tool, you can add all of your additional notes in this section here. So there is one other iteration of the kind of algorithm that I'd want to demonstrate to show the features of the tool. So again, we're just going to open up that tool again in the patient's chart. And this is the kind of path of the algorithm if we don't rule out the red flags at that second question. So let's say it's leg dominant and it's intermittent. What increases the patient's typical pain is all movements, but there is nothing that they can't do. We then we have two kind of additional questions that were part of ruling out the red flags, but because we didn't rule out the red flags at the question 2, we're served them now in question 5 and 6. So this is the question checking for quad-equine syndrome. So let's say yes, there is. We then are prompted to rule out the quad-equine syndrome. So looking at the different symptoms, if they are present, then we are served with the recommended intervention. But let's say instead no. We then are served with the final question, which is the last red flag related to inflammation. And let's say the answer is no, then we are instructed to move on to, again, the physical examination to refute or support the back pain that's been identified in history. So that's a kind of quick overview of the low back pain tool. If you have any questions on the tool or require any troubleshooting or one-on-one support, please don't hesitate to contact us as well. Thank you.